And I now give the floor to the distinguished representative of Partners in Population and Development.
Mr. Chair, Your Excellency, the Vice President of the Republic of Gambia, distinguished ministers, excellencies, colleagues and partners, I have the honor to speak on behalf of Partners in Population and Development, PPD, an intergovernmental alliance of 28 developing countries committed to advancing the programs of action of the International Conference on Population and Development through South-South and triangular cooperation. Allow me to thank the Secretary General for the report on population, technology and research on programs and intervention and on financial resource flows. Mr. Chair, the evidence is clear. Progress has been made, but the gaps remain too wide. Globally, about 260,000 women died in 2023 from causes related to pregnancy and childbirth, and 92% of those deaths occurred in low and lower medium-income countries. The global mortality ratio was, say, 197 deaths per 100,000 live births in 2013, far above SDG target of less than 70. On technology, the opportunity is enormous, but access is unequal. In 2025, 75% of the world population was online, yet 2.2 billion people remain offline, most of them in low and medium income countries. Mr. Chair, how do we close the gaps? First, we must invest in primary health care, midwifery, community health workers, community security, and right-based family planning. Second, we must close the digital divide, invest in not only infrastructure, but in local research capacity. Third, we must close the financial gap with both traditional and innovative instruments. Developing countries today face an annual SDG financing gap of around $4 trillion. In sexual and reproductive health specifically, UNFPA estimates that an additional $79 billion by 2030 to scale up essential family planning and maternal health interventions, which will generate about $660 billion in economic benefits. Mr. Chair, each dollar invested in family planning can yield nearly $27 in health and economic returns. This is where innovative and catalytic finance matters. Blended finance, result-based financing, pooled procurement, social and impact bonds, and match domestic co-financing and de-risking investment. Mr. Chair, PPD member states offer practical lessons in our member states in Egypt, in Thailand, Bangladesh, and Indonesia. These are not isolated successes. These are transferable solutions. This is precisely where PPD add value. PPD documents, validates, and disseminates good practices across member states. This can be adapted to countries with similar demographic patterns, fertility transitions, youth bulges, urbanization pressures, and health system constraints. Chair, Excellencies, the message from this commission should be clear. The ICPD agenda is achievable, but only if we match political declarations with data, technology financing, and implementation partnerships. Finally, Mr. Chair, PPD stands ready to work with member states, the United Nations systems, and development partners to scale best practices, mobilize catalytic financing, and accelerate delivery in countries that face similar demographic realities. I thank you, Mr. Chair. Thank you.